Good morning, everyone. My name is Amanda Bruton, and I am the owner of Medicare Answers Now, which is an FMO based out of Cleveland, Ohio. Today's training is in regard to VA, TRICARE, and CHAMPS, and I am super excited that we have McCoy from Humana that has agreed to go ahead and teach this class today for you guys. There is no one better that I know that can go ahead and give you the information about these programs, how to work with these beneficiaries, and how to move forward with this. So just some quick housekeeping. I did schedule this for an hour and a half so that we have more than enough time to answer all of your questions. You will not have speaking capability. You will need to go ahead and enter everything into the chat so that way we can field the questions from there. As we get them, we will ask the questions, read them out so that then Aaron can go ahead and field them through. For those of you that are new to me, welcome. I'm super excited to have you here. There are a ridiculous amount of trainings that I have scheduled over the month. You can find them on my website. If you have not checked that out, what you want to do is go to Medicare Answers Now, click onto the daily calendar, and then we load this up almost daily. There's an update in here, and you'll find the trainings that are coming up so that way you have them. So the next one is going to be the RSSA training, which will be at 2:00 on Friday. You just click in here, it tells you a little bit about it, and then there's the button to register. These classes are open to everybody, so find one that turns you on and then you're good to go. And yes, it is a little late as of right now, and that is just because the carriers are all coming back from the holidays and setting up all of their trainings now. There will get to be a point where there'll be 10 trainings a day, depending on the topics that you want. Aaron, it looks like we have quick count, probably about 15 different states in this room right now.
Okay.
We have East Coast to West Coast, and everything in between, which is super exciting. And we're climbing up all over the 90 mark. So, which is awesome. But with that being said, grab your pen and your paper, guys. I am going to go ahead and stop talking, turn this over to Aaron, and floor's all yours.
Thanks, Amanda, and thank you everybody for joining this morning. I will jump right into this. Great to see folks from across the entirety of the country joining us. Again, really appreciate you taking the time out of your morning to attend the training. Just real quick introduction. I was on our veterans channel team here at Humana for many years, but right at the beginning of AEP, I actually transitioned over to be a broker relationship manager here in Ohio. But here's my contact information. Should you need anything, I'm going to pop that up again at the end of the training this morning. But I've been with Humana over 10 years, worked in the veteran space specifically for over 5. And I did serve in the military as well. We might have some other veterans on here or military spouses. So if you are out there, thank you very much for your service. Really very much appreciate that. But I will jump right into what we're here to talk about today, which is kind of just working in the veteran space when it comes to Medicare, how to effectively position the product, how to sell, how to talk to those folks so that you can demonstrate your being the subject matter expert, and really feel comfortable working in this space when it comes to Medicare and really for our purposes today, Medicare Advantage. One of the things that we really encourage all agents to do every time you're working with a new prospect or client, at some point in the conversation is finding out, did they serve in the military, right? So you want to find out, hey, did you serve in the military at some point, whether that was active duty, reserves, National Guard. You also want to find out if maybe they're a spouse of a veteran, right? Because the spouse can have healthcare available to them or maybe enrolled in a type of healthcare we're going to talk about. And that's going to have an impact on your conversation as it relates to Medicare. So working that in, making sure it's a part of every conversation you have with a client is, to us really important. So however that's comfortable for you, it's something we would really encourage you to do. Obviously, it gives you a chance to really better understand that person. If they are a veteran, thank them for their service, of course. And also maybe find out other pathways to help other veterans. Veterans tend to hang out with veterans. So once you start to help one veteran, maybe you can find your way to helping others. And as we'll talk about today, with the different types of healthcare they have, Medicare Advantage can really make a lot of sense for those folks. And that's what we're going to talk about throughout the training today. And we're going to focus just on 3 main types of healthcare as we go through the training this morning. So there's 3 main types of healthcare that veterans and or their spouses have access to that we're going to talk about. First, we're going to talk about VA healthcare. That is specifically for veterans, and I'll talk a little bit more about that in detail as we go forward. Then we'll talk about TRICARE for Life and CHAMPVA kind of back to back. We do that intentionally, and I'll explain that when we get to that section a little bit more. But that's going to be for veterans, for their spouses, or for CHAMPVA, as an example, only for spouses. But I will clarify all that as we get into these 3 sections. One of the common things that I hear from agents or I see, and it's totally understandable. I can understand how this happens is everything becomes VA. So a lot of agents, when I talk to them, everything is VA. But we do want to remember there's 3 separate types of healthcare, which I'll go into detail on each of these types, that veterans and or their spouses may have access to. And sometimes a veteran might have access to more than one of these. So we want to remember not everything is VA. There's 3 different types of healthcare we're going to talk about, and we'll go into the details on that as we go through the webinar training this morning. So let's start with VA healthcare. This is probably the section we'll spend the most time on. The reason we do this is, one, to be completely honest with you, it's the easiest and most straightforward sales opportunity in my opinion. If you have VA healthcare, having Medicare Advantage makes so much sense. It's a large population of veterans across the country, about 9 million. But a few things to understand about VA healthcare as we get into it. One, it's technically a benefit. It's not insurance. I'll explain why we make that distinction, but it is a benefit. It's not technically speaking insurance. It's the largest integrated healthcare system in our country. So it's a huge healthcare system with serves 9 million people. And it's separate from Medicare. So it's really important to understand VA healthcare is not primary to Medicare. It's not secondary to Medicare. It's completely separate. But I'm going to kind of beat that dead horse, so to speak, as we go through this section, just to make sure everybody's clear on that. And then the last thing to know about VA healthcare is it works like an HMO. So you've got a primary care doctor you work through. You generally get referrals to see specialists, and you stay within a network. I'll expand on what that network is. It's not just VA facilities. But when you think of VA healthcare, think separate from Medicare, think a benefit, and think works like an HMO. So who can go to the VA? This is not something I am trying to make you an expert on. As an agent, you shouldn't really worry about qualifying or finding out or determining if somebody is eligible and qualifies for VA healthcare. So I'm just giving you some high-level information here, but ultimately what you want to know as an agent is, does the person I'm speaking with who's a veteran have VA healthcare? But really quickly, just so you're aware, not every veteran necessarily has access to the VA healthcare system. There is eligibility and qualification criteria that has to be met in order for a veteran to go to the VA. Your service generally makes you eligible, so when and for how long you served, and then having some type of qualifying either condition or criteria met also needs to be met. So that's generally by having what's called a service-connected disability. So some type of injury or disability that was caused during your time in the military, could be during training, could be stateside, does not have to be during deployment or overseas, or you might qualify based on your income. Again, there's more that goes into this, but we're not really trying to make you an expert on qualifying somebody for VA healthcare. What I generally tell agents is that if you're speaking with a veteran who's Medicare aged, and if they've never sought out VA healthcare benefits, or if it's been many, many years since they've looked into it, I would encourage them to seek that out. There's a VA healthcare hotline number. It's in our resource documents, and Amanda, I can share those with you if you want to disseminate them amongst the agents. But just point them in the direction of, hey, if you've never looked into it, or it's been many years since you've looked into your potential eligibility and qualification for VA healthcare, I would, maybe suggest that you give the VA a call and look into your potential eligibility and qualification. But for the remainder of this section, let's just focus on that veteran that you're meeting with who does have VA healthcare. So one of the important things to understand about VA healthcare, I mentioned that it's a benefit. It's not technically speaking insurance. The main reason we call this out and make this distinction during the training is it's unfortunately not considered creditable coverage for Part B, Bravo, of Medicare. So it's important to understand this as an agent, because if you're speaking with a veteran who's at the point of aging into Medicare, and if they are considering declining Part B, because they don't have to have Part B to continue to utilize the VA healthcare system. But if they're thinking about declining Part B of Medicare, you would want to be able to educate them on, hey, obviously you have every right to do that. But if you do decline Part B, one, it's of course going to limit your options outside of the VA healthcare system. And secondarily, if you change your mind later on down the road, that late enrollment penalty for Part B is most likely going to be sitting there waiting for you. So if it's a year, 2 years, 5 years, 10 years, there's that late enrollment penalty that now you're going to be paying for the rest of your life. And on top of that, the VA actually recommends that veterans maintain both Parts A and B of Medicare, because they know it gives them options outside of the VA healthcare system. So it's just really important to understand the reason we call out VA healthcare being a benefit, and the implications of the decision as it relates to Part B of Medicare when they're aging into Medicare. You're going to come across, or many of you probably already have come across, veterans who only have Part A of Medicare. I'm sure that's happened to you, and if it hasn't happened, it probably will at some point. For those veterans, the one thing I'll let you know is this is not a slam dunk. It'll work every time. There's no guarantee. But if they feel like they were misinformed as it relates to their Medicare options, if they were not educated appropriately on maintaining Part B of Medicare, they can appeal directly to their local Social Security office. I believe it's the CMS 40-B. I might have that wrong, but they can appeal for that penalty to be reduced or forgiven. There's no guarantee that will work, but it is an option that they can go down that path if they're interested in it. So it's something I just let agents know about, because I've heard from other agents it's kind of worked for them. But again, just important to understand the ramifications of that Part B decision when it comes to those veterans with VA healthcare. So what we're going to transition into now as it relates to VA healthcare is just some very basic information about VA healthcare, kind of how it works, what the costs are, different things that will help you be able to demonstrate when you're speaking with that veteran that you understand their VA healthcare benefit, and some basic information. And it helps inform you on what questions to ask. So as we go through this, I try to position it as, hey, here's some of the things you want to think about. Here's the questions you want to ask a veteran with VA healthcare as you're talking to them about their Medicare needs. So we're going to start with priority groups here. Every veteran within the VA healthcare system is assigned to one of 8 different priority groups. So when you go and sign up and enroll in VA healthcare, which is something you have to do, it's not automatic, you got to go sign up for it, they assign you to a priority group. Here's the first thing to know. Priority groups don't have anything to do with access to care or how quickly you're seen or in what order you're seen at the VA. So that is not what priority groups determine. Priority groups largely determine what, if anything, you pay for certain services when you utilize the VA healthcare system. When you're talking with a veteran, it is very common that they may not know which priority group that they're in. The reason I tell you that is because it's not necessarily a question you want to worry about asking them. You don't want to worry about asking a veteran, what priority group are you in? I always tell the story, when I first started using the VA healthcare system, I could not have told you what priority group I was in. I had no idea what priority group I was in. So that's pretty common. And again, it's not super important that you have that be a specific part of your conversation. But as I already mentioned, your priority group as a veteran within the VA healthcare system can determine what, if anything, you pay when utilizing the VA healthcare system. So the conversation you want to have, or maybe the question you want to ask is, hey, what do you pay when you utilize the VA healthcare system? Do you have a copay when you see a doctor at the VA, when you see a specialist, if you've been hospitalized, when you get a prescription, which we'll talk about here on the next slide? Some veterans, they're going to have copays for certain services when they utilize the VA. Other veterans that you speak to, they may not have a single copay for anything when they go to the VA. So that's going to vary from veteran to veteran. And that's why with each veteran that you speak with, when you're trying to kind of start to think about what their needs and wants are from a Medicare perspective, you want to have that conversation about their out-of-pocket costs when they utilize the VA. So again, some veterans are going to have those copays, other veterans are not. And we give you a couple examples of those copays. But again, the best way to do this is have that conversation, just like you do with any other client. You look at the plan they're currently on, you kind of go through what that plan covers, what the copays on that plan are, and then start to look to see if there's another option for them. This is a additional option for them, but this is a place we want to start that conversation. And also as a part of that conversation, we do want to talk about their drug coverage. So first and foremost, on the right-hand part of the screen, probably the most important thing that we'll want to mention here is veterans enrolled in the VA healthcare system have creditable drug coverage. It's counterintuitive that it's not creditable for Part B Bravo, but it is creditable for Part D drugs, right? It doesn't kind of make sense, but that's how it works. So every veteran enrolled in the VA healthcare system has creditable drug coverage. Again, some veterans are going to have copays for their prescriptions. We give you some examples on the screen here, and other veterans are not. Again, that's determined by their priority group. Even if they have copays, and you can see what those examples of the copays are, they have a $700 annual cap, which the way we think about it is really a max out of pocket. So their copays are relatively inexpensive. VA does prefer brand name and usually does almost exclusively mail order, just so you're aware. But overall, their out-of-pocket costs for their medications are pretty minimal when you think about drug coverage for Medicare beneficiaries. All that being said, just because they have creditable drug coverage through the VA doesn't necessarily mean we're automatically going to focus on MA-only plans, and we're not going to look at a MAPD plan as an example that has drug coverage. There are reasons a veteran might want to have additional separate drug coverage outside of the VA healthcare system, and they can do that if they want to. And there's a few reasons they might consider doing that. One, as cost effective as you can see the VA healthcare drug coverage is, they might be able to save money on their prescriptions. If they're only taking generics and they enroll in an MAPD with Humana, as an example, right, they could get those generics at $0 through CenterWell. So maybe they're only taking generics, and an MAPD plan will allow them to get all those generics at no cost. Flexibility can be a reason. Right now, with their VA healthcare benefit, generally they can pretty much only get their prescriptions through the VA. If they want to go to a CVS, a Walgreens, a local pharmacy, they generally speaking would need to meet a bunch of criteria to be able to do that. So they might want the flexibility to utilize a local pharmacy. Maybe they see doctors outside the VA on a somewhat regular basis, and if that doctor writes them a prescription, they just want to be able to drop it off and get it filled. So that's another reason they might consider having additional separate drug coverage outside the VA healthcare system. And then the third reason could be formulary options. It's possible the VA won't cover a very certain medication and an MAPD will. It's not super common, but those are some of the reasons that some veterans consider an MAPD compared to an MA-only plan. So it's just something you want to have be a part of your conversation with that veteran that has VA healthcare. Look at all plan options, right? For many veterans, that MA-only plan is a good fit. They go to the VA for everything. They don't maybe pay anything for their prescriptions. They don't really have a want to go outside the VA, and that MA-only plan is a great fit for them. But you just want to make sure you're exploring all plan options with them, so that we're looking at every angle on this thing, and making sure we're finding a plan that best fits all of their needs if prescription drug coverage is a need for them. And again, this is kind of reiterating what I already mentioned, but if they go to a provider, a doctor outside the VA on their own, and that provider writes them a prescription, they're almost, in a sense, going to have to go back through the VA and re-verify with their doctor at the VA and have the VA re-prescribe that medication to get it filled. That process can be more difficult or less difficult depending on the veteran, depending on which VA facility they're using. So it's not the same everywhere. But again, for this reason, some veterans look at an MAPD plan. So make sure that drug coverage benefit, having additional drug coverage out to the VA, is something you talk about. And the last thing I'll mention as it relates to drug coverage is because they have creditable drug coverage through the VA, they sometimes have access to a unique election period. It is called SEP-OCC for Humana's purposes, other creditable coverage. And what it allows you to do is if they're on a MAPD plan, or the crazy one I see sometimes is a med sup with a PDP. Sometimes it's crazy to me. You got a veteran on a med sup with a PDP who goes to the VA for everything. That OCC SEP allows you at any point throughout the year to move them from either an MAPD or a standalone PDP to an MA only plan. So because they have two forms of creditable drug coverage in that scenario, you can move them again from an MAPD or PDP plan to an MA only plan. So it is a unique opportunity sometimes. It's not something you come across all the time, but it is something that I just mentioned when we talk about VA healthcare and creditable drug coverage that they offer. All right. There's a question, where would we find the VA formulary? It's really public. If you Google search VA prescription formulary, you can find it. It is not the most user-friendly document. I'll be completely transparent with you, but it is just public knowledge if you Google search it. All right. Let me get through the VA healthcare system and I'll check in if we've got any questions I need to get to on VA. But let me get through VA before I answer the rest of the questions there. All right. So regardless of MAPD plan, MA only plan, one of the benefits, in my opinion, no-brainers as to why a veteran with VA healthcare would want to have a Medicare Advantage plan is emergency services. If a veteran is experiencing an emergency, and that emergency is not what the VA considers service connected. So them going to the emergency room means isn't caused by some type of condition that was caused by their service in the military. So if they fall around the house, if they get in a car accident, if they just hurt themselves in some way, right? Whatever the case may be, if it's not related to their service, then they have to meet certain criteria when they go to the nearest emergency room for the VA to cover that emergency room visit. And hopefully, if it's truly an emergency, they're never going to run into an issue and the VA would cover it. But the VA does have criteria that has to be met in order for them to cover that emergency room visit. Same goes for ambulance services. So the value of a Medicare Advantage plan is, hey, just in case, if you're traveling throughout the country, if you're going to visit friends and family in another state, if you're not going to be near the VA that you normally use, you know you have emergency coverage on this plan. You know you have copays associated with an emergency room visit, an ambulance ride. You have a max out of pocket. You're protected in that worst case scenario. Hopefully that worst case scenario never happens. Hopefully every instance you would find yourself in, the VA covers you. But just in case they don't, this plan offers you that coverage, offers you that emergency coverage outside of the VA healthcare system. This alone is one of the reasons I think Medicare Advantage plans make so much sense for veterans with VA healthcare, because it's separate, because it gives them that coverage outside the VA, and because it's that kind of, last ditch effort, so to speak. It's that safety net of having that emergency coverage through the VA. So emergency coverage to me is really an important part of that conversation. It's one of the selling points that you would want to hit on when you're talking with that veteran who has VA healthcare and also has Medicare. Now, I mentioned earlier when I described the VA healthcare system that it works and acts like an HMO. So you've got a primary care doctor, you get referrals to specialists, and you stay within a network. But what does that mean? What is the quote unquote network when we think of VA healthcare? Most people, rightfully so, would think, well, the VA hospital I see in my town or city or in my community, the VA clinic I see, those VA facilities absolutely are part of the VA healthcare system. But the VA also contracts with providers in the community. They're called community care providers. So they contract with Dr. Smith down the road, or they contract with Cleveland Clinic up here in Cleveland. And they can refer veterans to those providers when they meet certain criteria. So that network that is the VA healthcare system does go beyond VA healthcare facilities. Now, you do have to meet criteria in order to utilize those contracted providers. So if I'm up here in Cleveland and I go to the VA on a regular basis, I can't just make an appointment at the Cleveland Clinic on my own and then ask for the VA to cover it. I need to get a referral from the VA because they didn't have the type of doctor I needed at the VA. The wait time was too long at the VA. Or if I'm somewhere else in the state, how long it takes me to get to the VA is not reasonable. And then they need to refer me to that provider. But once they refer me to that provider, it works just like I'm going to the VA. If I normally would pay a copay when I go to the VA, that same copay would apply when I see that provider. Or if I normally would not pay a copay for those services, then no copay would apply here. But it's just good to understand as an agent that when you're speaking with a veteran that has VA healthcare and you're talking about the value of Medicare Advantage and emergency services and expanded network, more providers that you can see, one of the things you might hear from a veteran is, oh, well, I can already go outside the VA and the VA covers it. And it's good to understand what they're telling you so that you can say, oh, yeah, so they've referred you to a community care provider that you're utilizing. That's great. Good to know that. So it's good to understand this from that perspective. It's also good to understand this to help set your clients up for success when you enroll them. And this is what I mean by that. If the VA is referring a veteran to a local provider who's a community care contracted provider, and if that veteran has a Medicare Advantage plan, and if that veteran gives that provider's office their Medicare Advantage plan, they might bill that Medicare Advantage plan instead of billing the VA like they're supposed to because the VA referred them there. So something that I kind of encourage agents to do at the point of enrollment, and maybe during your follow-up 30, 60, 90-day calls is, hey, I just want to make sure you understand that with this plan, obviously you can utilize it to go outside the VA. But if the VA refers you to a local doctor, make sure that provider is not billing your Medicare Advantage plan and make sure that they're billing the VA. Because when the VA is the one that referred you to that provider, to that doctor, the VA is the one that needs to pay for it. Because then if they bill your Medicare Advantage plan, it's a whole process to get that reversed. They might end up paying a copay that they shouldn't have paid in the first place. And anything we can do to set them up for that success to avoid kind of going through that and getting it all reversed would be good. So that's one of the reasons that we talk about this provider network. This used to be called the Mission Act, but really you just hear community care providers nowadays. But it's good to understand this as an agent. One, so you understand what you're hearing from a veteran when they're talking about going outside the VA, and two, to set them up for success when you sign them up for a plan. Real quick here, some advantages, some disadvantages or challenges maybe when it comes to the VA healthcare system. Some of these things we already talked about, but VA healthcare, it's affordable. It understands the veteran population. It exclusively helps veterans. And an advantage in our case here as agents is they can have other coverage outside the VA, like an MAPD or an MA only plan. As we already discussed, not every veteran has access to the VA, but if they don't, we might want to encourage them to look into that. Getting to the VA can be an issue. We talked about that with the Mission Act and community care providers. One thing I kind of forgot to mention on the previous slide is, something you can do as an agent is if you're talking with a veteran and that veteran or their spouse is talking about, yeah, we go to the VA for everything, but it's really a pain. It's an hour and a half drive to go to the VA for the appointments. Well, have you asked the VA to refer you to somebody that's closer to you, to a local provider? If you're driving that long of a distance, they might be able to do that for you. So you can actually maybe help a veteran, not even with the plan necessarily, but just better utilizing and taking advantage of their VA healthcare. Certain doctors maybe aren't in the VA network, or veterans can't see those providers through the VA. So Medicare Advantage sometimes can address that. And a second opinion can be a big one sometimes. If the VA determines something, if they kind of render their opinion on a diagnosis and a course of treatment, it can be hard, sometimes impossible, to get a second opinion within the VA healthcare system. So if that could be a challenge, or if that's a challenge somebody's maybe worried about, again, having Medicare Advantage can address that challenge and give them the opportunity to go see a provider on their own and get that second opinion should they want it. Now, I mentioned I was going to kind of really beat this dead horse, I think is what I said at the beginning of this section, but it's really important to understand that, again, VA healthcare and Medicare and Medicare Advantage are completely separate. They do not coordinate. There is no primary. There is no secondary. So if they sign up for a Medicare Advantage plan, that's not going to disrupt or take away their VA healthcare. They still have access to the VA. They can continue to utilize the VA healthcare system as they have. And again, they can have an MA only plan or an MAPD plan. If they want additional separate drug coverage, they can have that MAPD if it's the right fit for them. But either MA only or MAPD is completely fine. Some veterans get weary about signing up for a plan because the VA does ask, do you have any other health insurance? The reason they ask for that is not to find out if you have other health insurance and then take away your VA healthcare benefit. They ask for that information because they can bill some types of private insurance. They can't bill Medicare and they cannot bill Medicare Advantage, but they can bill your employer coverage as an example, or your individual coverage maybe that you're signed up for. This is not a reason to sell a med sup to a veteran, but technically speaking, they can even bill a med sup. And they do this not even necessarily to lower the out-of-pocket cost a veteran pays. Oftentimes, the veteran wasn't going to pay anything anyway. What it really does is it offsets the VA's cost when they treat veterans for non-service connected care within the VA healthcare system. So really the reason they ask for that is because by billing that private insurance, again, not Medicare or Medicare Advantage, but other insurances, it helps offset some of the VA's costs. But that's why they ask for it. But it's not because if they find out the veteran has other coverage, they're going to take away their VA healthcare benefit. And then this last slide, and then I'll kind of go through the chat and see what questions we have out there to make sure I address any of those. This really kind of encapsulates kind of the key talking points, all the things we've already talked about, but these are the things that you want to hit on when it comes to really selling the value of a Medicare Advantage plan. So we talked about emergency services, ambulance, emergency room, just generally speaking, having more providers to have access to. I think traveling is a big one, right? Like I live in Ohio as an example, but I go to Florida, then I go visit friends in Arizona. If I'm traveling a lot, it might not be super easy for me to utilize the VA as I travel. So having a Medicare Advantage plan, having the ability to go see a doctor when I want to and not have to work through the VA when I'm traveling, getting a second opinion, as we talked about as well, maybe that is a value that the Medicare Advantage plan can bring to the veteran. RX formulary options, which we already discussed, right? So for some veterans, maybe that MAPD plan makes sense. For others, that MA only plan is going to be a good fit, but we just want to make sure that's a part of that conversation. And then nowadays, right, all the savings opportunities, all the additional benefits are, of course, something that you want to hit on. I think a lot of agents, those of you that have been doing this for a while, right, when you're talking to a veteran with VA healthcare, you're almost maybe immediately pivoting to the extra benefits the plan offers. So you're talking about the dental coverage the plan has. You're talking about the Part B give back the plan has. You're talking about vision. You're talking about hearing. You're talking about all those extra benefits because generally speaking, they're not getting those extra benefits through the VA, right? Some veterans get dental through the VA, but that's a pretty small percentage. Most, if they want dental coverage, have to pay for it. Vision, yeah. Hearing, yeah. But extra vision, extra hearing, there's nothing wrong with that. And then you start to think about OTC benefits, healthy options, all those extra benefits that plans offer, right? The combination of that plan, all the benefits it offers them, access to care outside the VA, and then on top of that, extra benefits. Again, to me, in my opinion, it's a no-brainer as a veteran with VA healthcare and Medicare that you would want to have a Medicare Advantage plan, if only for the extra benefits potentially. Because many veterans, they're happy at the VA, they like going to the VA, they love their doctors and the people at the VA, and they're not going to change that. And that's great. But they can still have access to care outside the VA just in case they need it. And on top of that, a lot of times we can get them a bunch of extra benefits to really complement alongside their VA healthcare. So I will pause real quick. Look at the Q&A. What is the name of the SEP that you mentioned? SEP, OCC, or other creditable coverage is the SEP we utilize here at Humana if they have two forms of creditable drug coverage. If referred to the VA through the VA community care and the MAPD copay is less than the VA copay, is there a problem filing with the MAPD plan? Not really, actually. I don't think that would really disrupt anything. So if it's a $50 copay for the VA, but it would only be a $35 copay on their MAPD plan, I don't think it would actually disrupt anything. I've never got that question, but yeah, they would be able to take advantage of that. It shouldn't be an issue. Something I've wondered about, if there's a government shutdown, does that make it harder for veterans to get their RX through the VA during that time? Could that be used as a selling point for MAPD? I generally think VA healthcare and healthcare workers in general through the government, and this is like me off the top of my mind. I was in the National Guard, so sometimes when government shutdowns happen, we would get called off for our monthly drill or whatever. But healthcare workers, I believe, are priority, kind of like TSA and other things. So a lot of those things probably don't get disrupted. I I wouldn't recommend trying to use that as a selling point, just in my opinion. I don't know that that's really a selling point, thinking of a government shutdown. I would think those would be essential workers that even with a shutdown, they would continue to have access to. A lot of chat questions. Let me see. No, they do not need Part A for VA healthcare. That was a question. If someone has VA coverage, do they need a PDP? I think I kind of covered that. It just depends. Some people want that extra drug coverage. Some people don't. That's a conversation you want to have. Would the MAPD cancel their PDP VA benefits? No, they can have two forms of drug coverage. They can have an MAPD and VA healthcare side by side. Can they move from an MA to an MAPD plan? Not using that SEP I mentioned, obviously during any other election period, they can move from an MA only to an MAPD plan, but that SEP I mentioned is only for an MA only plan. Can you address community care where the VA will cover costs when outside providers are used? And does this apply in emergency situations? Yeah, so they have to refer them to utilize community care. Urgent care is one they can utilize as well without a referral. And emergency situations in a roundabout way does apply to community care. But again, they have to meet certain criteria. If the VA deems it wasn't truly an emergency, that's where they could potentially say, we're not going to cover these costs because it wasn't an emergency. TRICARE, we'll get to that, but yes, Humana does still manage TRICARE East, so we still do own that contract. Really, there's not really, there are some limited pharmacies that are in network for the VA, but that's only usually for urgent care. So they can utilize those pharmacies when they see an urgent care provider, and it's usually a very limited formulary they can utilize those pharmacies at. George is still out there, Pat. So yes, George Vukovic is our veteran community engagement executive in Ohio. So he's still available for you agents in Ohio that are trying to work and get engaged with veterans in the field. Could a veteran apply for MA plan anytime using SEP OCC? Yes, if they have two forms of creditable drug coverage, they can utilize that SEP OCC any time of the year to enroll again in an MA only plan. A person I just talked with said the VA will not cover Oxy for pain management. Is that correct? I don't know that that's necessarily true. Maybe the VA determined that the Oxy wasn't necessarily needed, but I believe they do cover narcotics if prescribed and needed. It's not like a blanket; they don't cover them necessarily. Does the MOOP really exist when they have VA benefits? Person just said the VA picks up everything as long as they call within 72 hours. Yeah, I mean, hopefully the VA would always cover even at an outside facility, at a non-VA facility. And 72 hours, that's a good call. That is generally the rule. You're supposed to notify the VA within 72 hours if you're at a non-VA facility for an emergency. The MOOP would really only occur if they found themselves in a situation where the VA said you didn't meet the criteria, you saw a doctor at the emergency room, whatever the case, and we're not covering it. And again, hopefully that would never happen. We want that emergency coverage. We want that MOOP just in case. Why are VA so concerned about getting an additional MA plan if it does not change their current plan VA benefits? Some people are just, I guess, don't like change. They're scared of the unknown, I think. But if you are confident in what you're telling them, if you're able to explain very directly that having this plan doesn't in no way impacts their VA healthcare benefits, I think you can help them understand that this is truly a benefit to them and isn't taking anything away from them. Hey, Leslie, I see your question there. Who qualifies for VA healthcare? I'll send that out, Amanda, in our email. There's a more detailed document on that. I really don't want to get into all the details of who qualifies, who doesn't. VA disability considered income? No, it's compensation. So VA disability is considered compensation, not income. Yes, meds prescribed by the VA, do they have to be filled through the VA? They can be filled through an MAPD. Like for Humana as an example, if they want them to be sent to Centerwell, they can send them to Centerwell if they request the VA to do that. All right, I think I got through most of these. So let me transition to our last two topics. If you have more questions, continue to utilize the chat. I'll continue to try to go through that. But I want to transition to our next two types of healthcare. And again, I'm going to reiterate this. not everything is VA. So let's remember that. We've got VA healthcare, which we just got finished talking about. Now we're going to talk about TRICARE for Life and CHAMPVA. So these are two additional types of healthcare available to veterans and or their spouses, or only their spouses. And I'll go through all that in detail as we get through this section. We talk about these two types of healthcare kind of together and back to back because they're very, very similar. There is a primary, there is a secondary. There's coordination of benefits and coverage that has to occur here. And quite frankly, a Medicare Advantage plan makes that coordination of coverage a little bit more complicated. So we're going to talk about that. We're going to talk about how they would navigate utilizing a Medicare Advantage plan with either type of coverage here. It can work. For some folks, this can be a great fit, and largely because of the extra benefits Medicare Advantage can offer them. And I'm going to continue to talk about this as we go through these two types of healthcare. But that is the value here. So let's just talk about it plainly. The value a TRICARE for Life or CHAMPVA beneficiary sees on a Medicare Advantage plan is not the copays, is not the max out of pocket, it's not the drug coverage. The value they see is the extra benefits. They see a Part B give back. They see dental coverage, which they don't get through TRICARE CHAMPVA. They see vision, they see hearing, they see OTC benefits. That is the value they see. And they can absolutely sign up for a plan and get those additional benefits. But it's a little more complicated for them because they have a secondary coverage. And that's what we're going to talk about. But it's really important to understand and acknowledge why they're interested in a Medicare Advantage plan, and then understand how to position a Medicare Advantage plan, how to talk about how it's going to work with their other coverage to make sure they understand it and they're going in with kind of eyes open, fully understanding how it's going to work. Because if you don't set it up appropriately, it can go sideways on you. And we don't want that for the beneficiary or for you as the agent. So we're going to talk about that. And we're going to start talking about that with focusing on TRICARE for Life first. So forget the words for life for just a second. TRICARE is for active duty, retired military, and their families. So when I'm serving in the military on active duty, I can be signed up for TRICARE. My family, my children can be signed up for TRICARE. When I go into the military, if I go into the military at age 19, I can retire from the military at age 39, potentially. Once I serve 20 years, I can retire. Sometimes you'll get medically retired too. That's possible. So maybe you have an injury you sustain and they med board you out and you get medically retired. So maybe I retire after 15 years because of injuries and things of that nature. But if I retire from the military at 39 or 45 or whatever, I can continue to maintain TRICARE for me, for my spouse, and for my children. My children are going to age out around age 23 or so, but I'll continue to have TRICARE for me and my family. Me and my spouse will maintain TRICARE up until we reach Medicare age. And then once we become eligible for Medicare, now we're going to transition to TRICARE for Life. And all TRICARE for Life means is that Medicare is primary and TRICARE is secondary. So TRICARE for Life means I have Medicare, Medicare is primary, and TRICARE is secondary. You have to sign up for Parts A and B of Medicare as soon as you're eligible if you want to continue to have TRICARE. If you decline Part B, you no longer have access to TRICARE. So once you're eligible for Medicare, you absolutely have to sign up for Parts A and B of Medicare, and you will pay your own Part B premium. So you do incur that Part B premium, which some retirees and their spouses aren't too happy about, but they do pay for their own Medicare Part B premium, which obviously is why they're interested in a lot of these plans that offer a Part B give back, right? So that all makes sense when you think about it. But let's just talk about how original Parts A and B of Medicare works as primary coverage to TRICARE. It acts like a med sub. So Medicare first, TRICARE second. Other than their Part B premium, they don't pay anything. They can see any provider who accepts Medicare. They don't need referrals or anything like that. And again, Medicare pays first, TRICARE pays second. And if it's covered by Medicare and it's covered by TRICARE, which is almost everything, there's very few exceptions to that, They're not going to pay anything out of pocket. And probably the most convenient part of how Medicare works as primary coverage to TRICARE is the billing between Medicare and TRICARE is automatic. It is set up on the back end so that when they show their Medicare card to a provider and that provider bills Medicare, Medicare automatically bills TRICARE secondary coverage. So their Part B deductible or their 20% or whatever you want to consider when it comes to Medicare cost, that gets paid to the provider by TRICARE directly, and it happens automatically. And then on top of that, they already have creditable drug coverage. It's managed by Express Scripts. They have a $3,000 max out of pocket. They call it a catastrophic cap, and they don't have a coverage gap. They can utilize Express Scripts mail order, of course, and they do have access to about 41,000 retail pharmacies that Express Scripts contracts throughout the country. So they basically, with original Medicare and TRICARE, have a MedSup with built-in drug coverage for all intents and purposes. Technically speaking, of course, they don't have a MedSup with drug coverage, but that's how it works. That's how it acts. So again, they're interested in a Medicare Advantage plan because of the additional benefits it offers. That is what they're interested in, which again, they have every right to sign up for a Medicare Advantage plan and take advantage of those additional benefits. But there are some things they will need to navigate when they do that, and that you want to talk through them with in detail to make sure it's absolutely a good fit. Because if you don't set them up and explain this to them and you don't talk through this in detail, it can go wrong. They can get upset. They find out they have a copay that they shouldn't be paying and they don't know what to do about it. And now they're mad at you as the agent because you quote unquote didn't tell them about it. So here are the three main things that you need to consider and talk through if a TRICARE for Life beneficiary is wanting to sign up for a Medicare Advantage plan. First and foremost, the claims process will change. Medicare Advantage plans will not automatically bill TRICARE secondary coverage. TRICARE will not automatically pay that member's copay to the provider's office. It is now going to be the beneficiary's responsibility to make sure that after the Medicare Advantage plan pays, that the TRICARE acts and pays a secondary coverage. So they're going to have a conversation with their provider's office and say, look, I've got Medicare Advantage. Here's my Medicare Advantage card, but I also have TRICARE, and here's my TRICARE information. I need you to build a Medicare Advantage plan first, and then you're going to need to build TRICARE. This technically happens through Wisconsin Physician Services. They are the third-party administrator of the claims between Medicare and TRICARE. So they're going to be telling that provider's office, I need you to bill Medicare Advantage first and then bill Wisconsin Physician Services. If they're set up on Wisconsin Physician Services provider portal, it should be pretty easy for them to do that if they're already set up. If they're not, it's not a super involved, complicated process for them to get on Wisconsin Physician Services provider portal. And they could potentially ask the provider's office to do that. However, it is important to understand you as the agent can't guarantee that every doctor or provider they utilize is going to be set up and able and willing to do the secondary billing of Wisconsin Physician Services. So they need to be educated and understand that if for any reason a provider is not able or willing to facilitate the secondary billing of TRICARE through WPS, then they're going to need to submit for reimbursement directly to Wisconsin Physician Services. There's a reimbursement form called a DD 2642 that they would need to fill out and submit with the bill for the copay, potentially the summary of benefits, evidence of coverage, depending on what WPS requests. And they would have a year from the time of service to submit that for reimbursement. But again, it's important that if they're wanting a Medicare Advantage plan, we're not just talking about all the great additional benefits it offers, which of course it does, but we're also talking about the change to how their claims are going to be processed and the conversations they're going to need to have with their doctors and providers. The second thing we're going to want to talk about is network. Now, I would lean towards an MA only, and I'll explain that in more detail. And I'd probably lean towards a PPO as well for these beneficiaries. I'm probably not going to put a TRICARE for Life beneficiary in an HMO plan because low copays, that's not where we're going at. We're hoping to set them up for success and understand how TRICARE is going to pay the copays on the plan, right? But even on a PPO, we do need to be aware of the network. And there's two main things we need to be aware of when it comes to the network. First and foremost, on a PPO, they've got to make sure the plan's gonna or the provider's gonna accept the plan, right? So yeah, having a PPO allows you to go out of network, but if that doctor office, if that provider's not gonna accept the plan, if they won't build a Medicare Advantage plan, then it's not gonna do them any good. So they got to make sure that out of network provider accepts the plan. Now, if it's a passive network, if the in and out of network costs are the same and they're going to accept the plan, they should be good. But if they accept the plan and a certain service out of network is 50% coinsurance, as an example, they might want to check with Wisconsin Physician Services before receiving those services just to make sure they're going to pick up the entirety of that cost. There's no defined dollar amount limits that TRICARE puts out in writing, but there can be allowable limits. So if they're utilizing an out-of-network provider, depending on the out-of-network cost that you're going to get billed on that Medicare Advantage plan, they might want to check with Wisconsin Physician Services first to make sure they're going to pick up the entirety of the cost. Because as the agent and for the beneficiary, we wouldn't want them to have unexpected out-of-pocket costs that would not have existed had they stayed in network or were they still on original Medicare. So we want to make sure they're aware of the network on the plan and how to navigate it. And I already mentioned how I would, in my opinion, I would lean towards an MA only plan. So I talked about the fact that they already have creditable drug coverage through Express Scripts with $3,000 MOOP, no coverage gap. If we put them in an MAPD plan, that MAPD plan and that drug coverage in that plan now is their primary drug coverage. They can't use the Express Scripts mail order pharmacy anymore should they enroll in an MAPD plan. So they lose access to that. Technically speaking, their Express Scripts, their drug coverage through TRICARE is secondary drug coverage. But if they want both to be billed, they'll need to utilize a pharmacy that's in network for the MAPD and also in network for Express Scripts. And as an agent, unfortunately, you're not going to have a way to really discuss in any type of detail what their ultimate out-of-pocket costs would be for their prescriptions, right? So you can talk about what their copays for their prescriptions would be on that MAPD plan, but you are not going to have any way to look up or find out what TRICARE is going to pick up on those copays, right? So, well, the copay on this tier 4 medication is $100 as a made up example, and TRICARE Express Scripts, they're going to pay $40 of that. So you're really only going to pay $60. You don't have any way to look that up. You don't have a way to do that, right? So you're kind of going into it blind. So what I usually tell agents when it comes to a Medicare Advantage plan for TRICARE for Life beneficiaries, obviously talking about the claims process, obviously talking about the network on the plan and how to navigate it. When it comes to MA only versus MAPD, the MAPD probably only would make sense if there are specific reasons that they're telling you they want an MAPD plan. They've already been utilizing an MAPD plan and they know how to coordinate the two drug coverages. Maybe they don't have a certain medication in the Express Scripts formulary on TRICARE. So they're looking for a plan on MAPD plan that does cover that medication, right? So there could be extenuating circumstances, but outside of those, you're probably going to lean towards an MA only plan. The one exception, and this is a little bit of a unicorn, so I get like 2 or 3 agents a year that tell me about this, is if you have a fully dual eligible TRICARE for Life beneficiary, it is not that common, but it does happen every once in a while. You're going to treat that person just like any other dual eligible beneficiary. So you're going to look for a dual eligible plan most likely because really their TRICARE coverage is inconsequential at that point because Medicare and Medicaid are going to coordinate on everything. So if they're fully dual eligible, then you're just going to treat them like any other dual eligible beneficiary. But again, outside of that, probably going to look at an MA only plan and want to make sure we discuss these things. And ultimately, this is what it comes down to, right? What is more important? Are the additional benefits the Medicare Advantage plan offers them the most important thing to them? Or is the ease of use that comes along with original Medicare coordinating with TRICARE more important? If they want nothing to do with talking to a doctor's office to coordinate claims, if they don't ever want to deal with a reimbursement form, if they don't want to think about a network, I'm being extreme here, of course, but if they don't want to deal with those things, maybe those additional benefits just aren't important enough for them to do that. But again, for other beneficiaries, for other TRICARE for Life beneficiaries, the veteran, the spouse, if they're okay, if they understand what they need to do to navigate these things, and those extra benefits are really important to them, then they can absolutely sign up for a plan. We just want to make sure we're talking through these things and they understand them in detail before we sign them up. All right. Right. If a spouse is eligible for TRICARE for Life as well as Medicare, but still working and on their employer plan, will they be required to enroll in Part B for TRICARE for Life to continue? Yes, it's a good question. So they don't have to take Part B, obviously. They can delay their Part B if they have employer coverage. And then they can get it later on when they retire and lose their employer coverage. But if they delay their Part B, they will not have TRICARE. And TRICARE probably is acting as secondary coverage to their employer coverage at that time. It will stop acting as secondary coverage if they delay Part B. It is a weird one, but they do have to take Part B. They don't have an option. Again, they can delay Part B if they have employer coverage, and the late enrollment penalty shouldn't apply. But for that time period, they will not have access to TRICARE. So someone retires after 20 years, works at Ford Motor and has an employer coverage and will work till age. Oh, I just answered that. Yes, you can defer Part B as I just mentioned, but they won't have TRICARE for the time period that they're delaying and deferring their Part B. I have a question about government benefits. I just learned my dad does not have Part B. He only has Part A, but he has health insurance benefits from the government and pays over $500 a month for his benefits. He wasn't told he needed about. Ooh, that's a tough one. Maybe if you don't mind, Viola, if you want to send me a email, and I pop my email up at the end, I'll look at that. He might have federal employee health benefits. There's been a lot of changes to that lately, so that's a weird, odd one. Appealing to Social Security is the first thing I'm thinking of potentially, because maybe he was misinformed on his need for Part B, but send me an email. That one's a little bit in the weeds. I don't want to take too much time here on that, but I appreciate your question. Do you feel the give back is extremely valuable? I think that's dependent on the person you're speaking with. For some people, 100 or 100 something dollars a month is really meaningful. For some people who retired from the military, had a second career, retired from that career, did really well. For some of those folks, they're probably paying Part B IRMA too. Some of those retirees, $1,200 a year. I mean, it sounds crazy maybe to some folks, but it might not mean anything to them. So some of those TRICARE beneficiaries, they do very well financially. So $100 a month, $150 a month even might not mean anything to them, and they just don't care about it. So a veteran can have VA coverage, TRICARE, and a MA or MAPD. Yes, Deborah, they can. So you can retire from the military, have TRICARE as a veteran, also have VA healthcare because you qualify and you're eligible for VA healthcare, and also have a Medicare Advantage plan. So yes, that can happen. It's not super uncommon that a veteran has TRICARE and VA healthcare. You'll come across that very often. So you're saying that if the MD doesn't bill WPS, the vet will have to pay and get reimbursed. Yes. To be sure, if an MA or MAPD plan does not pay for out-of-network costs, TRICARE won't pay either. It's not that they won't pay, it's just that there could be limits. So if they go out of network, well, if the provider won't accept the plan, then TRICARE is not going to pick up the entirety of that cost. But even if they do build a Medicare Advantage plan out of network, then if it's a 50% coinsurance, again, that's just an example that I'm putting out there, but there could be limits as to how much of that 50% TRICARE will pay. I don't know how the Inflation Reduction Act impacts the $3,000 MAPS for $3,000 MOOP for TRICARE for Life. So I don't have an answer to that one right now. I'd have to look into it. An MA plan also now has them get pre-approval for procedures and care they wouldn't need with TRICARE for Life. Yeah, there's probably less that they need to navigate in terms of approval on certain services and things of that nature. So that's a good call on that one. I never actually talked about that, but that's a good call on that one. Maybe less strings, less hoops to jump through with original Medicare for some of those folks. San Antonio members lose access to the military base for services. This is because active duty are primary and they would prefer to go out. This has been critical. Oh, yeah, that does happen. Can you brief the doctor not willing to facilitate the billing? Does the vet have to ask them MD before we put them in an MA plan? They could. I mean, they could definitely check with their doctors they're seeing and make sure they know how to bill as secondary coverage to Wisconsin Physician Services. But I think that's ultimately up to you and the member as to what level of detail you want to go into prior to enrollment to make sure that they and you are comfortable as the agent. Yes, a veteran can have TRICARE for life and VA healthcare. That can happen. They can retire from the military and get TRICARE for life while also being eligible and qualifying for VA healthcare based on a lot of times having a service-connected disability. So that's very common. If a member has MA only with TRICARE for life, I'm assuming, and a doctor writes a prescription, how do they get it filled? They would get it filled through Express Scripts. So they can ask them to do it to mail order Express Scripts or go to an Express Scripts in-network pharmacy to get it filled. No, TRICARE and CHAMPVA does not offer vision and hearing benefits. They can pay for them as extra, but it's not included for TRICARE and CHAMPVA. So if a veteran has VA coverage, TRICARE, and MA or MAPD, does Medicare still pay first, and what's the order? If they go to the VA or the VA refers them to somebody, it's just VA healthcare. If they go outside of the VA, then Medicare is primary, or in this case, Medicare Advantage, and TRICARE is secondary, and VA has nothing to do with it. So again, VA healthcare is separate from everything else. It just depends on if they're utilizing the VA or if they're utilizing Medicare, their Medicare Advantage plan with TRICARE secondary coverage outside the VA. So if someone has an MAPD plan with a MOOP and TRICARE for life with a MOOP, they have to pay both. That one's a little more complicated. Ultimately, the $3,000 catastrophic cap on the drug coverage through TRICARE should be the only one that actually applies. But again, how that's going to work, how the secondary billing works with their MAPD drug coverage and their TRICARE Express Scripts drug coverage is not something that you can plan out or talk to them with in detail because you don't have access to Express Script systems to look up their drug costs. All right. Last section here, I think we're doing pretty well on time, but last section is CHAMPVA, and this should be relatively easy because this is almost identical to the conversation that we just had when it relates to TRICARE for life. So the reason we talk about CHAMPVA right after we talk about TRICARE is because for all intents and purposes, the conversation you're going to have with a CHAMPVA beneficiary is almost identical to the conversation you're going to have with a TRICARE for life beneficiary. So if you're hopefully starting to feel comfortable with how the conversation goes and the important things you need to talk about, we're just going to kind of reinforce that as we go through this last section. But the difference here, and the reason we do want to call this out specifically, is CHAMPVA is that third type of coverage. And this coverage is actually available to spouses and dependents of veterans. So CHAMPVA is not actually for the veteran themselves. It's for their spouse and their dependents if they meet certain criteria. So real quick, what's that criteria? If a veteran is rated permanently and totally disabled due to a service-connected disability, if they were at the time of their death, if a service-connected disability causes the veteran's death, or if a veteran dies while on active duty, then that veteran's spouse and dependents will gain access to CHAMPVA. Now, in the rare circumstance, and this is not something you would need to determine, but in the rare circumstance where a veteran retires and is permanently and totally disabled, meaning technically that veteran's spouse and dependents would be eligible for both TRICARE and CHAMPVA. If that occurs, TRICARE trumps CHAMPVA and they would get TRICARE, not CHAMPVA. But this is the criteria for which spouses and dependents of veterans would be eligible for CHAMPVA. And like we discussed with TRICARE, dependents are going to age out in their early 20s, but spouses, they will maintain CHAMPVA up and through Medicare eligibility. And just as we discussed earlier, they absolutely have to sign up for Part B of Medicare, and they will pay that Medicare Part B premium once they become eligible for Medicare. And they must do this because this probably looks familiar, right? Medicare is primary and CHAMPVA is secondary. So again, we're just going to reinforce what we talked about, but now we're just talking specifically about CHAMPVA. They can see any provider who accepts Medicare. If the service is covered by Medicare and CHAMPVA, they generally speaking should not have an out-of-pocket cost. The billing between the two should be automatic, so it's pretty seamless. And again, they already have creditable drug coverage through CHAMPVA. Looks identical, right? $3,000 max out of pocket, no coverage gap. Mail order, their mail order benefit is called Meds by Mail, but they have a mail order benefit they can utilize. Generally for generics, generally at no cost to them. And they also do have access to over 60,000 retail pharmacies. That network of pharmacies for CHAMPVA beneficiaries is managed by OptumRx. So CHAMPVA beneficiaries, once they become eligible for Medicare, it's almost like they have a med sub with built-in drug coverage. So again, very similar to the conversation we had earlier just now about TRICARE for Life. So again, they are interested in those extra benefits. That's what they want. They don't need lower copays. They don't need a lower max out of pocket. They are looking for that Part B give back. They're looking for that vision, that hearing, that dental coverage that's included in plans, right? Healthy options allowance, OTC, all those things are the things that they're looking at. So we have to have that same conversation when it comes to a Medicare Advantage plan for CHAMPVA beneficiaries. So first and foremost, that claims process changes. So just like we talked about earlier, but slightly different because now it's CHAMPVA, they're going to need to talk to their provider's offices if they enroll in a Medicare Advantage plan and request that they bill the Medicare Advantage plan first and then bill CHAMPVA as secondary coverage. Again, if their provider's not able or willing to do that, then there's a reimbursement form. It's a different reimbursement form for CHAMPVA, of course, but there's a reimbursement form that they would need to fill out and submit after they would pay that copay. So we're getting those extra benefits, but the way your claims are processed is going to be a little bit more of your responsibility. So we want to talk through that and make sure you understand what you'll need to do should you sign up for the Medicare Advantage plan. Network implications again, right? So we have to consider a network. PPO is probably where we would lean here again. MA only plan again is probably where we would lean here again. But even with that PPO, we need to talk about a couple things. One, if they go out of network, they got to make sure the provider accepts the plan. If they don't accept the plan, it's not going to do them any good. And depending on what the out-of-network, out-of-pocket costs are, they'd probably want to check with CHAMPVA to make sure they're going to cover the entirety of that out-of-network cost. Easiest thing to do, of course, is to stay in network. I totally understand that's counterintuitive when you're selling the value of a PPO plan, but for these beneficiaries specifically, staying in network is always going to be the easiest thing. But again, the claims process change and the network and how to navigate it are going to be two of the big things you want to talk about. And then third and lastly, drug coverage again. Again, I'm going to lean here towards an MA only plan if we're going to enroll somebody. If we put them in an MAPD plan, that becomes their primary drug coverage. They can't use that meds by mail benefit anymore. So now we've kind of, in a sense, taken that away from them when we sign them up for the MAPD plan. They've got to use pharmacies that are in network for both if they want to utilize CHAMPVA as secondary drug coverage. But again, how that's going to coordinate, what their out-of-pocket cost is ultimately going to be for any prescription that's not a generic is something we're not going to be able to really discuss with them. And they could be in the position of filling out reimbursement forms if they use a pharmacy that's in network for the MAPD, but not in network for OptumRx. But again, even in that instance, we don't exactly know. We can't intelligently speak to what and how much of that copay on the MAPD the CHAMPVA is going to pick up. So again, unless they have a specific reason, certain medications, they've already been coordinating the drug coverage through an MAPD, or again, that rare instance maybe where they're dual eligible, we're going to treat them like any other dual eligible beneficiary. For most folks, if they're interested in that Medicare Advantage plan, we're probably going to look at an MA only plan to not disrupt or interfere with the drug coverage that they already have that is already creditable. And again, it ultimately comes down to, it's like this scale, right? What is more important? We've got extra benefits. We've got Part B give back. We've got dental. We've got vision. We've got OTC. Hey, very substantial extra benefits. So I am not discounting that at all. We got that here. And then on the other hand, we've got ease of use, automatic coordination of claims, seeing any provider who accepts Medicare. What is more important to that beneficiary? And that's ultimately what it comes down to. But again, as we discussed with TRICARE for Life, if they're not comfortable, if they're not understanding what they're telling you, and I know as agents, you get that sometimes, right? You're like, I'm telling this person something, but they clearly are not understanding. In this instance, you really want to make sure they understand what you're telling them. But if they're okay with that claims process change, if they understand the network implications and just how to navigate that, or a lot of these folks are already in plans. So maybe what you're doing is just moving them to a plan that's a better fit. They've already been utilizing this, experiencing this. They know how to navigate it, right? So for some folks, it can be a good fit. It's just if we're going to sign them up, we do want to make sure it truly is a good fit, because if they're really not comfortable with the claims process, if they're really not comfortable thinking about navigating a network, those extra benefits aren't something that they're super excited about, right? They're $100 a month is great, but not that big a deal. We just got to make that decision for what's best for the beneficiary, what's best for the veteran, or in this case, the spouse of that veteran. All right. Last Q&A here. My sister's husband is medically retired from the Army. They currently get TRICARE. If he dies before they become Medicare eligible, would she go to CHAMPVA or TRICARE for life? She should maintain TRICARE for life. And hopefully that doesn't happen, but she should maintain TRICARE for life, unless she were to remarry. That would be the only instance where she would kind of lose access to that TRICARE for life. Do CHAMPVA beneficiaries get a CHAMPVA card, or do they get a military ID card to present along with their Medicare red, white, and blue card? They usually have it is like a CHAMPVA card. They'll have like an Optum RX specific card for their prescriptions, but yeah, they should have a card. I can't remember off the top of mind exactly what that looks like, but they should have some type of CHAMPVA card. But again, though, part of the automatic coordination of claims is that Medicare kind of talks to quote unquote CHAMPVA on the back end. So a lot of times they don't even need that card. The provider just kind of sees once they bill Medicare that automatic payment by CHAMPVA secondary coverage, but they should have a card. Trying to understand. Wife has CHAMPVA. If I enroll her into an MA, who pays first, second? MA always will be first, or Medicare, but MA would be primary. CHAMPVA would be secondary. And the claims form, I have a resource doc I can send out. We have a link to that reimbursement form that's listed there. But the claims form it's also just you're able to just look at it online. You can Google search it, but I have a link to it we can send out. Yes, good question, Amy. Can you use the SCP OCC to switch them from the MAPD to MA only and get back the mail order benefits? Yeah, that would be actually a great opportunity. So if you have a TRICARE for Life beneficiary or a CHAMPVA beneficiary who's on an MAPD plan, and we just want to put them back on an MA only, so we're not interfering with their drug coverage they already have, you could use that SCP OCC to make that switch. So yeah, great call there. What is the MOOP for VA drug coverage? It's $700 at the VA. So they have it's called a annual cap, but the most a veteran would pay for drugs through the VA healthcare system in a year would be $700. All right. These are examples of our Q&A doc and our resource doc. So Amanda, if you'd like, I'm happy to send these to you if you want to distribute them to those that registered and or attended today's webinar. But these are helpful phone numbers, links to reimbursement forms, some of the frequently asked questions that we get. The FAQ doc in a large way kind of encapsulates what we talked about today. So we don't send out this presentation because honestly, a lot could be lost in translation if you're just looking at these slides and not having somebody speak to them. So the FAQ is a little bit more comprehensive when it comes to that. And yes, SEP OCC can be used any time of the year. So yeah, you can use that other creditable coverage. If they have two forms of creditable drug coverage, you can utilize that SEP any point throughout the year. It's not a veteran specific SEP. Sometimes folks kind of conflate the fact that we talk about it here and think it's just a veteran SEP. I don't know exactly where it would apply outside of veterans, but if you have two forms of creditable drug coverage, VA and MAPD, CHAMPVA and MAPD, TRICARE and MAPD, you can move from an MAPD or standalone PDP to a MA only plan. And then as I promised, here is my email address. Here is my phone number as well. So that's my work cell phone number. I've maintained a 813 number despite living in the 216 area now. But that's my work cell phone, and you can take that down. And if you need anything, you're welcome to email me and or call me should you have any questions. But I have reached the end of our presentation, my presentation. I am at 15 minutes past the hour, so within our allotted time, Amanda. And I think I answered all the questions as best I could, but I'll shut up for a little bit because I've been talking a lot.
I will. Well, I appreciate it. It was a great presentation. I am going to last call questions. Do you have any additional questions? Put them in the chat so that Aaron can go ahead and answer them. And then we will let you guys go. But I hope you guys found it informative. Now you can, I'm sure, see and understand why it is that I have him come talk. The recording will be posted once I go ahead and I get it uploaded and all of the other stuff. I will throw it out on social media so that way you guys have it. And then you'll have the replay on that. I will also do a follow-up email with the documents that Aaron is referring to, along with his contact information, so that way you guys have it. This will not be the last that you hear of him from him. He's doing another presentation of the same presentation, another one, I believe it's in April. We tried to do it one per quarter so that way you guys had it. So if you miss this or want to take it again, register for that one. And you're good to go. Gina, where on social media will it be posted? Honey, I'm everywhere. So you should be able to go ahead and find it. It'll be on my personal page. It'll be in my groups. Which for those of you that don't know what those groups are, I have two. I actually have three. One is Medicare motivation and marketing, and I always mix those all up when I say it, so it's a combination of those three names. And then the other one is Miss Medicare, of course, which that is girls only. And then I have a dedicated group, which is for the agents that are part of my downline. So that one is invitation only. But the Medicare Marketing and Motivation Facebook is open and co-ed to any agent, and Ms. Medicare is female only. You can go ahead and join both of those groups or connect to me through Facebook. You cannot miss my headshot because it's the same one that was on your screen a minute ago. And then also you can, I do have a YouTube channel, which I think it's Insurance Training by Amanda Bruton, but if you Google my name, it comes up. So, feel free to check that out. And it looks like we don't have any more questions. So Aaron, thank you so much for doing this. Everybody, I hope that you have a happy new year. And Aaron, I think we peaked at 120 plus agents that were on the line. So
You always bring
really
your
good
crowd.
turnout. So thank you all. Thank you for getting up early for my West Coast people. And I will talk with all of you soon. Thank you.